All right, here's my favorite book. The authors of this book, awesome people. All right, so Neuro-Ophthalmology, my favorite stuff. So I'm just going to warn you, the anatomy chapter is brutal to get through, especially as a beginning resident. Don't try and read all of it at once. It is important, really, to have most of the anatomy of the eye, the structures around the eye, and the neuroanatomy memorized. Memorize all of that. But not just memorize it for a test. Be able to picture it in your head, so that way, as you're examining the patient and as you're trying to figure out what's going on, you're not just trying to grasp at abstract concepts, but really have a good idea of, okay, this person's having this problem with their vision. I can mentally just kind of hone in on these structures because I understand the anatomy. So imaging and neuro-ophthalmology, it's always important to know what to order, how to order it. You start out with decreased vision, how to assess it. This used to be one gigantic chapter about retinal optic nerve chiasm disease and retrochiasmal disease. So that used to be one big chapter. Thankfully, they've split that up a little bit. So again, don't try and sit and read that chapter in one sitting. About transient visual loss, illusions and hallucinations and higher cortical function, abnormal ocular motility, and supranuclear disorders, nystagmus, pupillary abnormalities, eyelid or facial abnormalities, head, ocular, facial pain, and functional vision loss as well. Patients with systemic diseases that might be associated with neuro-ophthalmology. So we're starting to kind of expand on that. So just to kind of dive in here really briefly. So neuroanatomy, like I said, can be kind of tedious. This is kind of the other side of the anatomy that is in the fundamentals book, right? So a lot of great pictures and diagrams and descriptions. But again, this is not something that you want to just gloss through. What's going to be more helpful is, while there are a lot of specific facts that you're going to need to know, it's also really helpful to start kind of recognizing how all of these things work. So not just kind of looking at this picture, but really mentally thinking through, how would you see this type of problem in clinic and how would you assess it? What would you see? And then correlating that with the diagrams. I'd even go to something like radiopedia.org, where they have tons of free radiographic images where you can correlate that with what the MRI shows. That might be a good way to kind of help study through a lot of these diagrams and descriptions. And then talking about neuroimaging again, so looking at what normal looks like, understanding what the reports are saying. So when you read through those radiology reports and they're saying, oh, Meckel's cave looks normal, where is that? Okay, you see it right there. Even if you don't end up doing neuro-ophthalmology, and even if you barely ever order MRI scans or CTs or whatever else, when you get a chance, both in residency and when you're out in practice, still do your best, take a look at the scans yourself. Not because you are an expert neuroradiologist, and in fact, even as a neuro-ophthalmologist, I can't say that I'm just a super expert at reading a lot of the neuroimaging that comes out. But one, the more you look at these images, the better experience you'll have at recognizing different structures. And then two, because you're seeing the patient in clinic, you're the one who kind of understands what the problems are, what kinds of concerns you're looking at. And the more information that you have, if you can look at a scan and say, I'm really concerned about, maybe a venous thrombosis, like in this case, right? So you see that kind of missing area right here. And it could be that the neuroradiologist kind of saw that and just kind of noted it as incidental. But you can say, no, this patient's presenting with papilledema and declining vision, and I'm really concerned about a venous sinus thrombosis. Even if you write that down in your note, sometimes just be able to look at the scan and say, I don't really understand what that is. You can call your neuroradiologist and say, hey, I'm looking at the scans here. Can you go through it with me? And giving that extra information can be really helpful for your patients. This really, really big chapter looking at all of the different optic neuropathies. Here's a flow chart of thinking through transient visual loss. Here's that famous simultagnosia picture It's helpful not just to read about it, but to watch videos and then do it yourself, because that's really how you're going to learn. So it shows you videos of the different kinds of nystagmus. I think that's a whole lot better than just trying to study all of these schematic representations and trying to figure out what that actually looks like in clinic. It's pictures about how the pupils work. NMO and MOG are becoming a lot more well recognized.